What is ADHD, and what are the varying degrees along the ADHD spectrum?
Good question again. The ADHD stands for Attention Deficit Hyperactivity Disorder. 20 years ago, we would say the child is either ADD, Attention Deficit Disorder, or ADHD, Attention Deficit Hyperactivity Disorder, with a lot of motor movement. Today, we call everything ADHD. And then we break it into little categories. So the definition has changed over the years. Some people argue the newer definition doesn't make as much sense. And the reason is, even inattentive ADHD, they're saying, well, that's a contradiction in terms. Well, it might be. But the DSM-4 ADHD criteria is now, okay, if I'm interviewing a young girl who's got inattention, I still have to categorize her as ADHD, inattention subtype. What causes it? Well, the theories switch back and forth like the pendulum on a clock. So we have to talk about what theory makes sense at this time, in this timeline, meaning today. Is it a neurodevelopmental disorder, meaning will everyone grow out of it? Or if you have ADHD, are you going to have it for the rest of your life? For many years, and during my residency days, we described it as a neurodevelopmental disorder. Dr. Zemetkin did some really nice preliminary studies on ADHD and said, well, it's a 30-30-30 split, meaning 30% will get better, 30% will carry it on into adulthood. Usually around age 19, 21, you'll know. And 30% end up with more serious problems, including possible trouble with the legal system and the law, and might get themselves into substance abuse and other problems. Today, there's other theories which also talk about ADHD is looking more of a permanent condition, that you have it, it just changes its presentation as you get older. And what is it? The definition is the frontal lobe not functioning up to its full potential. And with that, you get a lot of impulsivity. You could get focusing problems. You can't focus on your teacher. You can't complete your task. And there's three main spheres you want to see ADHD in, because it can be overdiagnosed quite easily. You need to see it in school, you need to see it at home, and you need to see it socially. And we also look at, okay, what is happening? And the Conners used to be the great screener tool, and if the Conners in the school match the parents' questionnaire, then you have more data support. We do have a diagnosis of ADHD. And the old Conners was good also at screening other types of things that could look a lot like ADHD. So in essence, what we're looking at is frontal lobe and tracts from the frontal lobe deeper that deal with executive functioning of the brain and ability to focus, concentrate, initiate a task, start an assignment, follow through with the assignment, and completion of the assignment. So some ADHD kids might have a garage full of uncompleted things, or some ADHD kids might not be able to start the test, and some get lost in the middle of the test.
What might predispose someone to the development of ADHD?
In some cases, there's a genetic history where one of the parents, for example, had ADD or ADHD, and that increases the risk. There's also thought sometimes that, growing up in a disruptive family, anxious family, is a risk factor. Or in our modern society where everyone's busy and has less time for each other, might be a factor.
What are the differences between ADHD in children and ADHD in adults?
Another good question. Only recently have we really seen this in the adult population. And that's because we weren't looking for it. So probably within the last 15 years, we've been diagnosing ADHD in the adults. And there's been a number of criteria for ADHD in the adult. And the reason is because the symptom clusters look different. Whereas you might have ADHD through childhood, can't sit in your seat, fidgety Phil or, squirmy person in the seat. And that turns into an adult who may have problems balancing the checkbook, looking after finances, figuring out what to eat for dinner, scheduling problems, late for work, can't keep a job, relationship problems, difficulty socializing. And if you add it all together, you'll see that the adult criteria look quite different, but still also quite debilitating because they cannot, every day for them is a challenge.
How is it that you diagnose ADHD?
It's what we call a clinical diagnosis, as is true for every mental illness. We don't diagnose on the basis of blood tests or x-rays or things like that. It's always based on the description of the symptoms, how they present when you look at them, and the story of their history. So for ADHD, we base it on, there are two ways of going about it. One is sitting down and taking a history, their story, and going over what symptoms they have. And the other way is to give them tests, which are pen and paper tests, where you fill out yes or no to different questions about types of symptoms and so on. So one's a more formal approach with tests, and one's more informal with just simply asking people questions.
Is there a link between ADHD and learning disabilities?
Yes, they frequently occur together, presumably because there are changes in the brain going on that affect more than one system. That's about all I can tell you about that, but certainly the number of children in school who are having trouble will have both rather than just one. Some will have just ADD or ADHD, and the others will have just learning disability, but some have both.
Yeah, learning disabilities, there's a number of advancements there. We now have nonverbal learning disability, or NVLD. We have the learning disability, we can call it chapter, really has advanced tremendously with a number of different screening tools and a number of things to look for. And when you look at ADHD, there's a high potential for learning disability in general. And so if you have ADHD, again, the statistics keep changing, but some people have said, well, if you have ADHD, there's 50 to 80% chance you might have a learning disability. Let's screen for that. So you have an LD or a nonverbal learning disability, these all things need to be addressed. And remediation and tutoring, specialized tutoring for those kids need to be addressed right away. And most people, because there is some controversy around the ADHD treatment, people were treated with stimulants at the very beginning by pediatricians, actually, which goes back about 50 years. And they found that with the fidgety Phil or hypermotor child, that they used a stimulant, which doesn't make a lot of sense, but it worked beautifully in these children for calming them down and getting them to focus. Over the years, stimulants continue to be used. They're still the mainstay in the more moderate to severe form of ADHD. If you have mild ADHD, you might not even not need a medicine, just structure and maybe a study buddy or a telephone chaperone to get you going, get your schedule straightened out. You get into moderate or severe form, you most likely would want a trial on a medicine. Stimulants are still used. There's a few medicines. Atomoxetine is one. It's a non-stimulant, and in the old days we also used bupropion. We still do. And the newer one now, which is used all these years, but it's an alpha-adrenergic agonist, and in the old days it would be called clonidine, and guanfacine is what we're calling it now, which is working well. It's actually a blood pressure medicine to calm the hypermotor part down. And those are the three main groups.